over again and over again and over again. Isn't that right? So just remember in the back of your mind, epi will be part of the management. Epinephrine. You good? Let's pick up another one. Let's turn to strip number 12.
V-TAC.
Oh, good girl. Now you're going to tell me why. Since you're such a little smart ass, why?
No. You know why?
I ain't mad at you though, because you woke now. Okay, I got a good reason why this is V-TAC. Now, let's look at it first, because we are very intelligent and we got to study it for a minute, y'all. So when we look at it, would you agree that it looks like a whole bunch of QRSs?
Yep. Yes.
Aha. Would you agree they're happening awfully fast?
Yes.
So let's just think about that, because we are the shit. We now know a little bit about EKGs. For example, we know that QRSs that are doing funky shit is a reflection of ventricle drama. Ventricular. And we also know if they're too close together, happening too fast, that's tachycardia. It's that simple. Ventricular tachycardia. It's that simple. There's nothing else that could be, because it's happening so fast and it's all in the ventricles. The QRSs are coming too fast. It's gotta be ventricular tachycardia. It's gotta be. Now, your problem with that strip is that V-TAC may or may not have a pulse. So your first nursing action with V-TAC is check for a pulse. Let me tell you how that goes in real life, because my goal is for you to be the best nurse in the world, not just pass a fucking test. If you look at the front page, again, the answers are there. If you look at the front page, you'll see it says V-TAC, attack, check for pulse. First nursing action is check for pulse. So far, so good, beloved? Now, here's how that plays out in real world. I swear to God, this shit is so crazy. I'll be sitting at the desk doing some charting, and the secretary, we call him a huck, and what is it, the unit coordinator, some shit, huck. Anyway, my girl, she gonna be working. We're gonna celebrate our birthday together. So she gonna be working. Miss Kathy, that's my girl. She'll call out, y'all got V-TAC in room 7, or you'll hear the alarm. That's room 8 doing V-TAC again. Okay, what drives me to drink, and I don't drink at all, but if I did, I would fucking turn the tequila up on this particular situation. Because what drives me to drink is when I'm sitting there and she says that and none of these bitches move. You learned the first nursing action is to check for a pulse. I ain't seen no way to check for a pulse while you on Amazon. I have yet to see you be able to check for a pulse through Instagram. But these motherfuckers at the desk doing all of that. I don't care whose patient it is. I'm getting the fuck up and checking for a pulse. Because they take for granted, because you will, I'm not gonna lie, you will get V-TAC. You'll get that shit all the time. I don't give a fuck. I know cardiac. I get my ass up. I go in that room. I check for the fucking V-TAC. And I go in the room, and if it's night shift and the patient sleep, I walk right on over to that brother and I feel for the pulse. Now, if they're not asleep and they're able to talk to me, I'm feeling good about the situation. But here's what I noticed. You done called me 3 times in a 12-hour shift for this motherfucker with this V-TAC. I'm not going to keep just going in there checking for shit. Somewhere around the 3rd time, I'm tired of your ass. I'm calling the doctor, because what is it telling you? It's telling you any minute we're going to crash. So I'm all right with your little 4 beats of V-TAC and 7 beats of V-TAC later on in the night. You do that shit one more damn again and see won't I call your doctor. Because I'm going to need something different to happen. V-TAC is a very serious strip. And our nurses get caught up in the fact that any amount of V-TAC is not that big a deal. Because lots of times on the floor, they count the beats. And they say, well, less than 14 beats isn't that serious. No, you done did this shit 3 times. I need you to get off the pot and go on over there to the cardiac unit because I ain't got time to deal with this shit all night. So you belong in a cardiac unit because you are on a regular floor throwing me V-TAC? Oh, hell no. So you see where I'm going with this? Don't be so textbooky. Common sense tell you, you learned in school that V-TAC was next to V-fib in seriousness. Now you comfortable on Amazon chilling at the desk with your patient doing that shit. Then you gonna give me a report and I'm gonna call you out. You know I'm gonna call you out. You gonna give me a report and say, well, they had 3 episodes of V-TAC last night. And I'm gonna say, what the fuck you do about it? Boo-boo. Jesus. Okay, so you good? It says attack. Don't sit on this shit. It says attack. V-TAC is attack. Find out what the fuck is going on with your patient. Because that is not normal to just throw V-TAC all over the damn place. It's not normal. You look at that strip. Look at the strip. It looks crazy. You don't want to see that. You don't want to look at that. It looks crazy. It's crazy.
What meds would you give for V-TAC?
Well, that's just it.
Everything.
You getting your fucking ass off my unit. That's what you're doing.
Okay.
But until then, let's handle the business. So if your patient is doing V-TAC with a pulse, everyone, you have 2 options. Are you ready? You're going to write it on the strip, y'all. This is one option because technically this is this is cardioversion medicine. It's a pill of cardioversion. Amiodarone is a cardioversion medication. That's what the fuck it is. So this is an option. And watch, we got to rhyme. We got to rhyme with these crazy fast heart rates. You ready for your rhyme? If the meds don't work, then we cardiovert.
Okay.
And that's only with fast heart rates. Not slow, because we pace them. If the meds don't work, then you cardiovert. Now, you guys are thebomb.com, so I'm going to see what you say to this. If you walk in the room and the motherfucker ain't got no pulse, this is easy. What are you doing first?
CPR. Okay.
Y'all got it. Yes, you're going to pound on that motherfucker's chest. Chest compressions, call for a defibrillator. You got this shit. Told you it's easy. Next.
What's another name for amiodarone?
Nothing. Cardarone, but we don't ever call it that. Okay, so here we go, beautiful babies. Are you ready? We got more love. I want my little babies to go to strip number 4. What's going on with 4, y'all? Do some damn shit with 4. So let's do it together, shall we? We're going to do it together and we're going to see what we come up with because that's how we do up in here. First of all, do we agree we can't count nothing falling off the page?
Yeah.
So whatever's falling off the page, we don't give a fuck. We trying to find, look. We trying to find a small, smooth, predictable P wave. Are you good with that?
Yeah.
And we're trying to see if that small, smooth, predictable P wave is hugged up against a QRS complex. Did you find any P's?
Yes.
Me too. Did you find a big old spike right after?
Yes.
Me too. Did you find a bigger mountain than the P called a T after that?
Sometimes.
Me too.
Yes,
Yes, sometimes.
Every time. What the fuck is that sometime bullshit? We on strip number 4 while y'all talking shit.
Oh, okay.
Yes. We was off.
I'm gonna try that again. Does everybody see the little tiny P?
Yes.
Hugged up against the QRS.
Yes.
Right after that comes a bigger mountain called a T.
Yes.
Did it repeat over and over and over again?
Yes.
Did you count your R's?
Yes.
Let's do it. Let's do our R's.
Yeah.
I got 8 or 9. It don't matter. 80 or 90. We good. So we good. This is a normal sinus rhythm.
I wanted to say normal, but
You ain't want nothing. NSR, y'all. Now, on your test, what are they going to say? Continue to monitor.
What about the document?
You're going to see everything. So that's number 4. Don't fuck it up and put it in number 3, y'all. This is number 4 right here. Normal sinus rhythm, NSR. Continue to monitor as a nursing action. Y'all did good. Okay, we're going to do another one because we're doing it.
it's fine.
Wait a minute, boo-boo. Kitty, wait. Wait a minute. Okay, let's go to strip number 7.
Okay.
Oh, I know this.
When you look at strip number 7, what do you notice even if you're not that good with EKGs?
It's fast.
It's fast. Yes. Now, we got a rule. We got a rule, y'all. Watch this. If it's fast and it's greater than 150, it's what?
SVT.
SVTs. Let's count our R's and see if that qualifies.
Oh, yeah, this is one.
Technically, it qualifies, doesn't it? So it's 160 because you had 16 R's. Everybody agree?
Yes.
Make sure you agree. I want to wait on you if you kind of confused. Count your R's on strip number 7. Count the tippy tops of the spikes. Those are R's. How many did you get, everyone? 16. Did you get 16?
Yeah.
Okay. Did you get 16, baby?
Yeah.
Okay. Everybody got their 16. So by definition, this strip, we are going to call it SVTs, but we're also going to use it for something else in a little while. For now, it's SVTs. Write it on there. Now, you learned it yesterday. It was a bigger word, and it was for a bigger heart rate. What was that word? Adenosine slam.
Oh, yeah.
Don't leave off the slam. Okay, here we go. So SVTs, write it on your strip, gets treated with an adenosine slam.
You got like what, 8 seconds? Or
10.
10.
Okay, now, here's our issue. I like to keep it real. No bullshit. In real life need to come up in your backyard, not just textbook bullshit. In real life, there are no SVTs in the 160s. They are always in the 200s. Do not be alarmed. My pregnant patient was all up in the 220s. So these people are young. Some of them are pregnant, and they're not that bad. They're easy to treat. What could we do first before drugs? How do we do that with the patient? What do we tell them to do to get that?
Breathe through like a straw.
Actually hold their breath and just bear down.
Oh,
That sometimes will take them right up out of SVTs. So we tell them just a Valsalva maneuver, hold your breath, bear down, boom. you can get yourself out of this a lot of times. If that didn't work and we use adenosine, right? Then we use our adenosine slam and we push it super fast and we flush it right after. So that's good. You guys know that. Uh-oh. Do we agree it's a fast heart rate? So if the meds don't work, then we
CARDIOVERT.
You got it. If the meds don't work, then we CARDIOVERT. You got it. It's that simple. Fast heart rates are CARDIOVERT. Slow heart rates are paced. Exactly. My feelings exactly.
Do you keep
Now.
finding on here?
Huh?
You keep finding on here?
Yes, you need a Tylenol and a